Magnetic resonance elastography, or MRE, is a relatively new and developing imaging technique that quantitatively measures the mechanical properties of soft tissue. It uses a combination of MRI technology and low-frequency mechanical waves, specifically shear waves, to produce both a structural image and a map of tissue stiffness called an elastogram. The theory behind this technique is that the stiffness of pathological tissue, like cancer, inflammation, and fibrosis, is different from a normal one, so pathological tissues propagate shear waves at different rates. MRE involves 3 steps: generating shear waves in the tissue using an electromechanical transducer on the skin, receiving an MR image based on the propagation of these waves in the tissue, and finally, the processing of the information in order to create an elastogram. Here are examples of elastograms. This is an image showing traditional MR images and elastograms with dotted line representing the liver. The softest tissue turn up purple and the hardest turn up red. This image shows the elastograms of healthy tissue, a 61-year-old patient with non-alcoholic fatty liver disease, and a 61-year-old patient with hepatitis C, cirrhosis, and cancer. As we can see with a patient with hepatitis C, cirrhosis, and cancer, he has a significant amount of stiff tissue due to his diseases. Compared to other imaging modalities, such as the attenuation coefficient in X-rays and CT, T1 relaxation times in MRI, and bulk modulus in ultrasound, elastography techniques such as MRE can detect a wider range of tissues in various states of pathology.
Why is magnetic resonance elastography important? MRE has been successfully implemented in the assessment of diffusing liver disease. It allows for early diagnosis of liver fibrosis in general, which, if left untreated, could lead to cirrhosis, a type of liver damage that leads to formation of scar tissue, making it unable to perform its vital function. Several studies have established MRE as an accurate technique for differentiating fibrotic liver tissue from normal, with 80 to 98% sensitivity, 90 to 100% specificity, and 0.89 to 0.99 accuracy. That's why currently MRE is the most accurate non-invasive technique for detection and staging for liver fibrosis. As previously mentioned, MRE is an alternative to needle biopsy due to its associated risks. Needle biopsy of the liver involves taking a tiny amount of the tissue and using that to assess the state of the entire organ. This gives it the possibility of missing disease present in another part of the liver. Additionally, this could introduce sampling errors, which can lead to misconstrued staging of fibrosis. It can also, though rare, introduce complications such as bleeding, which can be avoided with MRE as it is non-invasive. MRE also has capability to measure cross-sectional areas of hepatic parenchyma, and it is not affected by ascites and obesity. It is also able to differentiate isolated fatty liver disease from steatohepatitis with or without fibrosis. Other than liver application, MRE has also been applied to a variety of diseases that alter soft tissue physical properties, including liver, breast, brain, heart, lung, and even the localization of prostate. In short, MRE provides a safer, more comfortable, non-invasive alternative to determine the level of liver disease through the use of low-frequency mechanical waves, thus adding to its medical value.
However, there are also limitations to this technique. As mentioned previously, MRE is still a relatively new technology. Further technical development and investigation still needs to be done, such as refining imaging sequences to produce more accurate shear stiffness values and signal-to-noise ratio. Another limitation could be that patients with hemochromatosis and iron overload conditions will not have accurate results due to limitation in signal-to-noise. Also, MRE still needs to be evaluated for its cost-effectiveness. Another popular medical imaging technique that measures the stiffness of tissue is ultrasound elastography, also known as sonoelastography. Like MRE, sonoelastography also uses shear waves to generate an image based on applied acoustic impulses and is similar in accuracy to MRE in detecting fibrosis stage and in technical failure rates. In comparison, sonoelastography uses ultrasound-based shear waves, while MRE is MRI-based and uses low-frequency waves. Sonoelastography techniques are relatively inexpensive, portable, and increasingly available compared to MRE. However, MRE provides a more wholesome image compared to sonoelastography as it only images a small portion of the tissue. This shows a sonoelastogram and this shows an MR elastogram. It also provides a higher diagnostic accuracy compared to ultrasound-based technique. According to Howard et al.'s review of existing literature on MRE and sonoelastography, they conclude that MRE has a technical accuracy of 94% compared to sonoelastography at 84%.
In conclusion, MRE has current applications in the non-invasive diagnosis and staging of hepatic fibrosis due to its high specificity and sensitivity and low risks for the patient. Its importance not only lies with the diagnosis of liver fibrosis, but also has potential in other areas such as cancer. However, as with any other medical techniques, it has its own limitations. It is also often compared to ultrasound elastography in existing literature. In the future, MRE may also be used for other diseases involving changes in the stiffness of tissue or the presence of malignant tumors. Currently, its potential application in detecting pathologies in organs like lungs, heart, brain, and breast tissue, among other things, are already being studied. With MRE's high potential, it is highly likely that it will soon be more readily available for clinical use despite its high cost.